Bismillah ar-Rahman ar-Rahim. Effects of local application of sodium bicarbonate paste in the wound care of diabetic foot wounds by European Egyptian pharmaceutical industries. Diabetes is now becoming a very important public health problem, especially in our area in the Middle East and Gulf area. As you see in this map, Egypt, Sudan, Saudi Arabia, and the Gulf region are among the highest prevalence countries in diabetes during the year 2019, and expected even to increase to more than 15% of the adult population by the year 2025. Foot ulceration is one of the most significant complications of diabetes. It affects 20% of people with diabetes at some point in their lives. Diabetic foot ulcer is the main risk factor for non-traumatic lower limb amputations, up to 60% of which occur in diabetic patients. Approximately 18.6 million people worldwide are affected by diabetic foot ulcer each year. Diabetic foot infection was classified as either limb-threatening or life-threatening. Limb-threatening infections could be defined as cellulitis extending beyond 2 cm from the ulcer perimeter, as well as deep abscess osteomyelitis or critical ischemia. The standard care for diabetic foot ulcers is a multidimensional approach. Controlling blood glucose, blood lipids, blood pressure, smoking, and other risk factors is essential. Diabetic foot education, offloading, and management of critical ischemia neuropathy are important for both prevention and treatment, while local wound care with good debridement, cleansing, and anti-infective wound dressings are the mainstay treatment for controlling infection and optimizing exudate control. Local wound care and dressings. Currently, a wide range of different dressing types are commercially available, but many studies and Cochrane reviews, meta-analyses, showed no significant difference in ulcer healing when the expensive synthetic active dressings such as alginate based dressing and negative pressure dressings are compared with the traditional dressings like the wet to dry saline mustard gauze, Vaseline gauze, and hydrofiber dressings. Antiseptic and antimicrobial agents. Several agents are currently being studied as topical antiseptic and antimicrobial agents for diabetic foot wounds. The ideal agent is not even reached now, but it should be safe, non-toxic, tissue-friendly, and inexpensive substance that can absorb excessive exudates and fetid odors while optimizing moisture and pH and the local milieu inside the wound to be unsuitable for growth of common pathogens known to flourish in such hypoxemic acidic tissue. Sodium bicarbonate or baking soda is becoming of interest as its physicochemical characteristics fulfill most of the features of this ideal agent for wound dressings. Sodium bicarbonate or baking soda is a white crystalline powder that is commonly used as a pH buffering agent or an electrolyte replenisher or systemic alkalinizer and as topical cleanser. The substance safety is well known. Lots of products are being used in medicine in different dosage forms to be administered systemically by parenteral or oral routes or used topically. And as we see here, there is intravenous preparations and preparation for oral tablets here. And this is vaginal louche by the pharmaceutical industry. It is in the form of vaginal douche, and this is gel for the skin. The antimicrobial and antibiofilm activity. Antimicrobial antibiofilm activities of sodium bicarbonate had been well documented in literature. A lot of literature are addressing this, and this is already proved, as you see in this paper. Antibacterial activity of baking soda. The antibacterial activity of baking soda, sodium bicarbonate, was assessed using 3 different experimental approaches. Standard minimal inhibitory concentration analyses revealed substantial inhibitory activity against streptococcus that was not due to tonic strength or high osmolarity. This also another paper. Antimicrobial activity of sodium bicarbonate. Sodium bicarbonate inhibited the growth of bacteria and yeast in agar media model system under certain conditions. Escherichia coli, Lactobacillus, Staphylococcus aureus, and Pseudomonas aeruginosa aerobic plate counts were reduced 10,000-fold by 1% concentration. Saccharomyces and Hansula were more sensitive. Counts were reduced 100,000-fold. Another study, bactericidal action of bicarbonate. Bactericidal action of bicarbonate ion on selected periodontal pathological microorganism. Sodium bicarbonate exerts its bactericidal effect was studied. Suspected periodontal pathogens were more sensitive to salts than were control non-oral bacteria. About the biofilm inhibition, this paper also addressed the antibacterial and antibiofilm formation. We found that sodium bicarbonate significantly inhibited, whereas sodium chloride did not influence the growth of planktonic bacteria and the biofilm. MBC measurements indicated that the effect of sodium bicarbonate is bacteriostatic. Sodium bicarbonate prevented biofilm formation as a function of concentration. Bicarbonate and alkalization of external pH induce a significant increase in intracellular cyclic AMP levels. In conclusion, sodium bicarbonate impedes the planktonic growth of different bacteria and impedes biofilm formation by many bacteria. Anyhow, a lot of studies are available online, and you can test and search for the antimicrobial antibiofilm activity of sodium bicarbonate. Topical products of baking soda. Many products based on sodium bicarbonate are already marketed for local or topical use, such as a preparation for intraocular irrigation during eye surgery, and that for oral or nasal or vaginal hygiene. Sodium bicarbonate has been also used topically as a paste with 3 parts baking soda to 1 part water to relieve insect bites and stings, as well as accompanying itching, pain, and swelling. Many surgeons reported that when they used sodium bicarbonate paste or irrigation topically on badly infected wounds, the bad smelly odors disappeared faster than usual and the wounds became less oozing and needed less frequent dressing than the usual scenarios with better final outcome. Here we present the results of a prospective single-arm observational study with a mean 16 weeks follow-up period. A series of 24 patients with limb-threatening diabetic foot wounds treated with sodium bicarbonate paste compounded by the European Egyptian Pharmaceutical Industries, Alexandria, Egypt. The preparation is provided in jars with plastic spatula and gauze dressing to be applied topically over the wounds and covered with a gauze dressing after thorough debridement and good washing and irrigation with normal saline solution. Patients and methods. Consecutive adult male or female patients presenting to a health insurance hospital in Alexandria, Egypt with criteria of limb-threatening diabetic foot wounds were screened and included in the study after signing informed consent. Patients with superficial mild ulcer, like Wagner grade 1 severity, or those with extensive gangrene or indication for amputation of the same extremity were excluded from the study. Also, pregnant females, critically ill patients, unconscious and uncooperative patients were excluded. Here are the results. 24 successive eligible accessible patients were included in the study. The baseline demographics and wounds Wagner severity grading are summarized in this table. 24 patients with the mean age 55.2 and standard deviation 7.9. 13 males and 11 females with Wagner grade 2, 11 patients, and Wagner grade 3, 13 patients. The overall response to treatment as the 16th week was excellent in both sexes and the severity grades. Treatment success was observed in 83.3% of cases in the form of almost complete healing in 50% of cases and partial healing in 33.3% of cases, where partial healing was defined as more than 50% reduction in the ulcer size, and complete healing is complete or 90%, more than 95% closure of the ulcer area. The clinical response here, according to Wagner grade, as you see here, Wagner grade 2, complete healing in 63.6% and more than 50% ulcer size reduction in 36.4%, while no failure and no reduction less than 50%. In Wagner class 3, 38.5% was completely healed and 30.8% having partial healing, that is to say more than 50% ulcer size reduction. Discussion. Other published studies on different conservative interventions, including wound debridement with antibiotics or antiseptics and dressing, have reported remission rates on average of 48.4 to 62.3% with limb salvage and less major amputations. Bacteria in chronic wounds, including diabetic foot wounds, are frequently present as biofilms, which are aggregated bacteria encased in a matrix which is composed of protein, DNA, and polysaccharides. Bacteria in biofilms may evade host defenses and become tolerant to antimicrobials, making biofilm infections particularly difficult to eradicate. Debridement can reduce the burden of biofilm infection and expose healthy tissue to functional immune cells. However, biofilms tends to occur in wound making, making it resistant to the usual antibiotic treatment. We assumed that part of the beneficial effect of our sodium bicarbonate-based dressing is coming from its antibiofilm antimicrobial activities in addition to the pH buffering and the hygroscopic action that adsorb exudate fetid odors in the edema while optimizing the moisture of the wound bed. In conclusion, local management of limb-threatening diabetic food wounds with sodium bicarbonate-based and gauze dressing after wound debridement might be a successful conservative option for limb salvage and avoidance of amputation. Sodium bicarbonate based by the Egyptian European pharmaceutical industry might be a convenient, tissue-friendly, and cost-effective product that might help to inhibit biofilm formation and the growth of common pathogens known to flourish in hypoxemic acid medium. It could optimize moisture of the wound bed while absorbing exudates, debris, and fetid odors, thus allowing to maintain the process of healing with less effort, less cost, and less frequency of changing dressings. And here are some pictures from our series of patients. This is before treatment and this is after 4 months. Before treatment, 1 month, 3 months. Before and after. Before and after. Before and after. Before and after 5 months. A male patient with deep ulcer exposing bone before and after. Before and after. Before and after. Before and after. Thank you very, very much.